Sounds good. We'll get started. All right, hey everybody. I'm Sarah Knack. I'm research fellow at Hennepin. I'm here on behalf of the research committee, and then Dr. Lemke King is presenting with me again today. So we're going to be talking to you about a new funding mechanism from the NIH. It's the Advanced Research Projects Agency for Health Strategic Plan, or ARPA-H. So no relevant disclosures to this presentation. So first we're going to talk a little bit about the history and the background of the ARPA-H program, how the program works, what the funding mechanisms are, and then we'll give some examples of project arcs and focus areas and kind of what work they're doing right now. So the mission of the ARPA-H program is to accelerate health outcomes for everyone and support the development of high-impact solutions to society's challenging problems. And there is a really good short video on the ARPA-H website that describes their process, and we weren't able to get it in here today, but I'll talk about it here a little bit more. So as opposed to traditional funding mechanisms where people are coming up with ideas and submitting that to funders, this program was started in 2022 and was given $1 billion of funding for the first 3 years, and essentially is flipping that around and selecting what are called program managers who have ideas and topic expertise and coming up with a difficult problem with no obvious solutions. It's meant to be very innovative and very fast-moving. So program managers come up with a challenge, an idea that they want to address, and are given funding to then disperse out to performers. Performers in this model can be in academics, can be in the industry, really across the spectrum. And so essentially, the program managers are reaching out to these individual players and figuring out kind of what piece of the puzzle they can solve, what they can give funding for. It's a really flexible program that gives a lot of options for these people. And these are supposed to be very challenging problems that require a lot of interdisciplinary work and a lot of kind of collaboration between industries and academics and all of that. So it's definitely a new structure. And the award types, they're called other transactions, and it's agreements between these performers with the program managers, and they leverage commercial business practice along with academics as well. They're meant to be collaborative and flexible, as I had mentioned before, and so many of the regular contract laws, regulations, IP agreements, all of that are much more flexible than traditional funding sources.
Thanks, Sarah. And related to her last slide, I actually had a slide in here, but we couldn't include it because of copyright infringement. But as you might imagine, these are ambitious projects. And so my slide for that was, I had a picture of Bruce Springsteen's Born to Run album, and I remember this great quote from him where he said, that was my first shot, just trying to hit a home run, trying to hit it out of the park. And so these are big, ambitious home run projects. And so my other disclosure, non-financial, that I should share was that part of the reason I'm giving this didactic talk was that we were considering submitting one of these, and it was just too big for us to take on. We couldn't get our proposal together in time. So I was going to report on that experience, but since we didn't actually get to submitting it, I can't report other than to say they're looking for big projects. These are the pie in the sky. Can we even do this? Again, along the sort of DARPA models of like moonshot type projects, right? So, and as Sarah just alluded to, so these are not traditional NIH grant mechanisms, and technically ARPA-H is actually, I think, its own separate entity, although Francis Collins was the one who kind of announced it. But these are contracts, and so after the product is not just getting published in like New England Journal of Medicine or whatever, these are things and products that are going to go out into the world and solve the problem that they're meant to solve. And so the sort of deliverables can go into this is from ARPA-H themselves. It can go into a variety of different sort of end solution forms. It could go into a company or sort of a startup. It might be a healthcare system, a traditional healthcare system, or it might go into even early stage venture capital type companies to continue to grow and develop. So that's what they're envisioning coming out of these projects. In terms of focus areas, this is again from ARPA-H directly. They're interested in health science futures, so trying to expand what's technically possible within healthcare. Scalable solutions, if that's a theme that you're interested in. Proactive health, and I know that this is emergency medicine, we tend to be reactive, but we also certainly have many people who do research in sort of the public health scheme and are proactive of keeping people from being patients. And then resilient systems, I think that's something that emergency physicians certainly know a lot about, and building integrated healthcare systems. So the programs I'm going to divide up into what ARPA-H essentially internally developed. So they have these organized into large programs that have several subcomponents, and they have a host of what are basically program officers. And so each program, there was a number of program officers who sort of spearheaded their own project, and that was ARPA-H initiated. And so here's some examples of some of those. So advanced analysis for precision cancer therapy, for example, and you can see the sort of program officer underneath. Antigens predicted for broad viral efficacy through computational experimentation, the ARPA-H Digital Health Security Initiative, and the ARPA-H Biomedical Data Fabric Toolbox. So those are just some examples. Some more here. You can see this range includes orthopedics, surgical interventions, transplant, cell therapies. So it really goes the gamut from basic science to health systems and data architecture and that sort of thing. And then at the time that we were preparing this didactic, they also had what's called an open BAA, so open broad agency announcement. And those of you who are familiar with Department of Defense funding, you'll recognize that acronym BAA. So it was a very similar model where they were inviting people to submit their ideas for programs like this, which would be broad, overarching problems to be solved. And this is an example of a program which I think was, I don't know if it was proposed or from ARPA-H itself, but it's called Paradigm. And just to give you an idea of like the overall scope. So it has 5 technical areas that they're intending to deliver at the end of the project. So designing distributed hospital level care, producing an integrated care delivery platform, harmonizing diverse medical device data in a single system, building a miniaturized, ruggedized CT scanner. So that's a very specific deliverable that within this bigger idea of bringing integrated healthcare. And then creating intelligent task guidance software to help health workers perform activities beyond their usual training. So they have this vision that they're going to provide services that are traditionally given in Mecca type health systems out into rural areas. And that's what the Paradigm program is all about. And so you can see that for each of those 5 things I just mentioned, there are sort of sub-deliverables, and each of those 5 things has sub-deliverables that are necessary for them to deliver. So they have this idea that they're going to create this scalable vehicle which can go out into rural areas and deliver services that are traditionally given in a healthcare setting. And so this is their sort of like proposal of what it could look like, but of course they're inviting people to come in and actually deliver on this. And under task 5, that addresses sort of like the workforce for this sort of scalable solution. So I mentioned the open BAA awardees, and so that proposal unfortunately just closed over the last month. So unfortunately, if you had a great idea and came to this talk, but that's not to say that they won't have probably another cycle. This cycle was open for about 18 months or so. So it may take 18 months for you to sort of get your ideas and get importantly, your collaborators, because I don't think this is the kind of thing that one person takes on their own. Certainly, it's going to require a team to even propose a sort of program. But these were the, 10 open announcement awardees. And again, so these are projects that have a similar sort of scale of providing rural healthcare basically in a new way. So you can see some of the examples include some very specific technologies such as photonic chips-based optical coherence tomography versus mapping the cancer and organ degradome atlas. So it's a wide range from sort of like specific technology and engineering to maybe traditional lab science-based projects, or defeating antibiotic resistance, which might be sort of more of a health systems project. So a wide range of activity and wide range of projects. So that's it. That was a short presentation. If you guys have any questions, we're happy to sort of take those. And on your way out, there is a feedback mechanism. So we appreciate any thoughts or comments. I do want to mention, just in passing, that actually one of the program officers, the one that I showed for Paragon for delivering sort of rural healthcare, the program officer actually is someone who is an emergency physician from Thomas Jefferson. His name's Bon Ku, so just of note for folks who were emergency physicians. And we did reach out to him. He couldn't unfortunately be here, but I think he'd welcome any inquiries into his particular project. So. And thank you very much for showing up, and for sorry about the snafu about timing, but thank you very much.